Chapter 35, Treatment of Acne. We'll skip over the terms and definitions for now. Acne is a disorder that causes plugged pores and outbreaks of lesions, which are commonly called pimples or zits. The sebaceous glands make sebum, which is an oily substance that normally empties onto the skin surface through the opening of the follicle or pore. Figure 35.1 shows adult acne. And figure 35.2 shows basically the normal pilosebaceous unit. When hair, sebum, and keratinocytes, the cells that line the follicle, fill the narrow follicle and produce a plug, it prevents sebum from reaching the surface of the skin through the pores. The mixture of oil and cells allows the bacteria, which normally lives on the skin, to grow in the plugged follicles. These bacteria produce chemicals and enzymes and attract white blood cells that cause inflammation. When the wall of the plugged follicle breaks down, it spills sebum, shedding skin cells and bacteria into the nearby skin, leading to lesions or pimples. Common acne or acne vulgaris occurs most frequently during adolescence because the rate of sebum secretion increases more than 5-fold between the ages of 10 and 19. People with acne frequently have a variety of lesions. The basic acne lesion, comedone, is simply an enlarged and plugged hair follicle and is the most characteristic sign of acne. If the plugged follicle or comedone stays beneath the skin, it is called a closed comedone and produces a white bump called a whitehead. A comedone that reaches the surface of the skin and opens up is called an open comedone or blackhead because it looks black on the skin's surface. The black discoloration is caused by changes in sebum as it is exposed to air. It is not caused by dirt. Whiteheads and blackheads may stay in the skin for a long time and are considered to be non-inflammatory acne. Blackheads and whiteheads normally release their contents at the surface of the skin and then heal. If the follicle wall ruptures, inflammatory acne can ensue. This rupture can be caused by random occurrence or by picking or touching the skin. This is why it's important to leave acne-prone skin relatively untouched. Troublesome acne lesions can develop, including the following: papules, inflamed lesions that occur as small pink bumps on the skin, can be tender to the touch. Pustules, or pimples, papules topped by yellow or white pus-filled lesions that may be red at the base. These pus-filled pimples result from secondary infections within or beneath the epidermis, often in a hair follicle or sweat pore. Nodules, large, painful, solid lesions that are lodged deep within the skin. Cysts that are deep, painful, pus-filled lesions that can cause scarring. Milia are tiny little bumps that occur when normally soft skin cells get trapped in small pockets on the surface of the skin. So medications and causes of acne, like we talked about, acne is way more prevalent in your adolescence, especially during puberty, because the hormones are increasing in both a male or female. So, of course, you're going to be more susceptible to acne during that time in your life. There is going to be hormonal changes during pregnancy or starting or stopping birth controls. So it's not uncommon for someone to say, I've never had acne ever until I was pregnant. Now I'm having acne. That's pretty common. Another factor can be hereditary or genetics. Researchers do believe that it can be inherited from your parents. And studies have shown that many school-age boys with acne have a family history of that disorder. Other risk factors for acne can be certain drugs, including androgens and lithium, and the use of greasy cosmetics. They may alter the cells of the follicles and make them stick together, producing a plug. 35.1, box 35.1 shows medications that trigger or exuberate acne. We have anabolic steroids, bromides, corticosteroids, corticotropin, isoniazid, lithium, and phentoin. And then we have some less common ones. Box 35.2 lists the factors that can worsen acne, changing hormone levels in adolescent girls and adult women 2 to 7 days before their menstrual period starts. So again, it's pretty common for menstrual aged women and girls to experience acne around their period. Oil from skin products like moisturizers or cosmetics or grease encountered in the work environment. So if you work in a kitchen with fry vats, of course, you're going to be around more oil. Pressure from sports helmets or equipment, backpacks, tight collars, or tight sports uniforms. Environmental irritants like pollution or high humidity. Squeezing or picking at blemishes and hard scrubbing of the skin. And stress is another cause of acne. There have been many theories concerning the cause of acne because adolescents commonly suffer from acne and indulge in fast food, junk food, and sweets. These food items are often blamed as the cause of acne. Not keeping one's skin clean is also blamed for causing blackheads, but that is also a myth. Another supposed cause of acne is stress. Stress in itself does not cause acne, but can make existing acne worse. Depending on the severity of the acne, one or more topical medications may be used over the counter and or prescription, or combined therapy with oral and topical medications may be recommended. Mild cases of acne can just be controlled at home by gently washing the area with warm water and mild soap, and of course, preventing it by washing your face daily, especially if you wear makeup. Is very important. So we have many topical OTC products. If you go to the skincare aisle at the regular grocery store or Target or whatever, so you'll find lotions, creams, washes, kits, scrubs, brushes, devices, gels, soaps, or pads. Treatment with OTC topical medications can take up to 8 weeks before noticeable improvement can be seen. Common active ingredients found that are in acne products are benzoyl peroxide, anywhere from 2.5% to 10%, salicylic acid, 0.5% to 5%, alpha hydroxy acids, and sulfur. Benzoyl peroxide is the most effective and widely used non-prescription medication currently available for the treatment of non-inflammatory acne. So benzoyl peroxide, you'll see lots of prescriptions brought in. Some insurances will cover it, some will not. So the ones that the insurance will not cover it, you just have to show them where to purchase benzoyl peroxide over the counter at your pharmacy. Salicylic acid is a mild comedolatic agent and surface keratolytic, which is a peeling agent, that helps break down blackheads and whiteheads and cuts down the shedding of cells lining the hair follicles. Combinations of sulfur 3 to 8% with resorcinol, which enhances the effects of the sulfur, are available without prescription. The combination is a keratolytic, fostering cell turnover and desquamation and helping break down blackheads and whiteheads. Over-the-counter acne products, the medication benzoyl peroxide, which we just talked about, it says there are more than 95 OTC brands, so that is a ton. If you just kind of include all of the store brands, like the Walgreens brand has a brand, I'm sure. CVS and all that stuff. So in this box here, we have the US brand names, which is all we care about. Acne Clear, Benzac, AC, Bravoxyl, Clearasil, Desquam, Neutrogena, Oxyacne, Panoxyl, Subaclear. So there's quite a few. And you will sometimes fill benzoyl peroxide if the insurance company covers it, or if the patient wants to use their FSA card to purchase it. Resorcinol and sulfur, the Actimel adult acne, and it's also available as Clearasil daily cleaner and Resamed. And then for salicylic acid, we have Clean and Clear, Advantage Spot Treatment, Clearasil, Ultra Rapid Action Treatment, Neutrogena, and Zapsit Acne Wash, probably more than that. In moderate to moderately severe acne, numerous whiteheads, blackheads, papules, and pustules appear to cover from 25% to 75% of the face and or other affected areas. Up to 100 comedones may be visible with 15 to 50 inflammatory lesions. Moderate to moderately severe acne usually requires the help of a dermatologist in combination therapy. So some treatments for moderate to moderately severe: physical methods such as comedone extraction or ultraviolet therapy, oral antibiotics that help stop or slow the growth of bacteria and reduce inflammation. So especially somebody that has a lot of acne, moderate to moderately severe, their face is going to be filled with more pimples than just, your mild acne, and that can kind of spread around. So the use of antibiotics is good for that. So it doesn't spread to more places, and it helps kind of kill the acne that's present on the skin. Vitamin A derivatives like retinoids, they unplug existing comedones, allowing other topical medications such as antibiotics to enter those follicles. Some can also help decrease the formation of comedones. Prescription strength topical keratolytics and oral contraceptives are known to help treat acne in women, especially young menstrual age. It's very common for someone to have rough or heavy periods and be like 12 or 13 and taking birth control. So again, when you're at the pharmacy, you should never judge anyone, obviously openly, but yourself in your own head, you shouldn't judge anyone that's on that, because like I said, it could be a 12-year-old that just has really bad periods. It doesn't mean that they're sexually active. And if they are, well, great, they're on birth control. So that's at least one thing, right? Oral and topical antibiotics may be prescribed for the treatment of acne and are initial therapy for patients with moderate to severe inflammatory acne. First line oral antibiotics have included tetracycline, doxycycline, and minocycline. So you can see all of those have that cycline ending. Clindamycin, sulfonamides, and erythromycin are less commonly used for the treatment of acne. Oral antibiotics must be taken for 6 to 8 weeks before results are evident, and treatment should be given for 6 months to prevent the development of microbial resistance. Oral antibiotics may be discontinued after inflammation has resolved. However, topical antibiotics may be continued for prophylaxis. Some patients may require long-term oral antibiotic therapy to control their acne and prevent scarring. So if you see a prescription for doxycycline and it's not for like 2 a day for 7 days, or 2 a day for 10 days, it's like a longer period, like quantity of 62 a day, you should have a general idea that it's for acne. Retinoids include vitamin A and its derivatives. Adapalene, tretinoin, and tazarotene are retinoids. Topical retinoids are effective in treating non-inflammatory acne because they reduce the number of comedones and prevent comedone formation, and they have a mild anti-inflammatory property. Adapalene is a retinoid type drug that affects the growth of skin cells and thereby reduces the formation of pimples. It is available for topical use only, and I believe this one is over the counter now. Tretinoin is a retinoid. It is used for the treatment of mild to moderate acne. It increases cell turnover in the follicular wall and decreases the cohesiveness of cells, leading to the extrusion of comedones and inhibition of the formation of new comedones. The rapid turnover of cells prevents new pimples from forming. Tretinoin is administered topically and orally. Clindamycin and tretinoin are combined as a topical formulation for the treatment of acne. Clindamycin belongs to the lincomycin antibiotic class and works by slowing or stopping the growth of bacteria. Topical clindamycin has minimal systemic absorption. Tretinoin is minimally absorbed following topical application. Tazarotene is a retinoid prodrug that modulates the differentiation and proliferation of epithelial tissue and has some anti-inflammatory and immunological activity. Azelaic acid occurs naturally and is found in whole grain and animal products. It reduces redness and inflammatory papules and pustules associated with rosacea and acne. It works by killing the bacteria that infects pores and by decreasing the production of keratin, a natural substance that could lead to the development of acne. This table shows drug treatment for moderate to moderately severe acne. So we've talked about adapalene. The brand name is different. A combination product of adapalene and benzoyl peroxide is Epiduo and Epiduo Forte. Panretin is a capsule and available as a gel. Well, actually, it's not available as a capsule in the United States because Toctino is in Canada. So it's available as a gel, which I was like, wow, capsule. I didn't know that. Benzoyl peroxide, we just talked about that in the previous table. Clindamycin has quite a few different dosage formulations as well. So it comes in a foam, it comes in a gel, a solution, and a swab. It's available under the brand names of Cleocin, Cleocin T. So you'll see Cleocin T gel or Cleocin T solution, Clindaderm, Clindagel, Clindense, and Evoclin. Erythromycin base, it's a topical gel or solution. And then it's a topical solution in a gel that is available under the brand name Erie Gel. Benzomycin is benzoyl peroxide and erythromycin together. Acania, Benzaclin, Duac, Nuac, Onexton are all brand names for the generic of benzoyl peroxide and clindamycin. And you can see there's quite a bit of different percentages and combination strengths. Dapsone, which is Axone, is available as a 5% and a 7.5% gel. Doxycycline hyclate is available as a capsule and a tablet and a delayed release tablet, which is Dorox. So Dorox you will see prescribed quite a bit for acne. It is delayed release, meaning they don't need to take as many throughout the day. But it can be kind of expensive. So you will sometimes see the capsule and the tablet prescribed for acne as well. Doxycycline monohydrate is the version of doxycycline that only has one hydrate, Monodox. So Monodox is available as a capsule and there is a tablet, Avadoxy. Minocycline, capsule, extended release capsules, tablets, and ER tablets. I would say that is probably what you see most commonly orally prescribed, at least for me where I worked. And then we have tretinoin and tretinoin plus clindamycin. So there's a few different combination products as well. Severe acne is characterized by deep cysts, inflammation, extensive damage to the skin, and scarring. Treatment involves non-pharmaceutical methods and medications, so such as isotretinoin, antibiotics, and oral contraceptives. For patients with severe inflammatory acne that does not approve with the medications discussed earlier, the physician may prescribe isotretinoin, a retinoid, which is, of course, a vitamin A derivative. It's an oral drug that is usually taken once or twice daily with food for 15 to 20 weeks. It decreases the size and output of sebaceous glands and makes the cells that are sloughed off into the sebaceous glands less sticky and therefore less able to form comedones. Isotretinoin can produce fetal abnormalities. Women must use two separate effective forms of birth control at the same time for 1 month before treatment begins, during the entire course of treatment, and for 1 full month after stopping the drug. Isotretinoin must be dispensed in the manufacturer's original packaging with the warning label, "Avoid pregnancy." To make sure that women do not become pregnant while taking isotretinoin, the FDA requires wholesalers, prescribers, pharmacies, and patients to participate in the I Pledge risk minimization program. Only prescribers that are registered and activated in iPledge can prescribe this medication, and only patients registered and qualified in iPledge can be given this medication. And you can go to that website and read more upon that. In some women, acne is caused by an excess of androgen hormones. Oral contraceptives help suppress androgens produced by the ovaries. The oral contraceptives used to treat acne typically have estrogen and progestins with a low androgen level. OCs that produce low androgenic effects include desogestrel, norgestimate, and the choice of OC is typically based on tolerability. And we aren't going to talk about them now because we talked about them in chapter 27. And you can go back there and get a full list of all of the oral contraceptives. Physicians may use other types of procedures in addition to drug therapy to treat patients with acne. The physician can remove the patient's comedones during an office visits. They can get corticosteroids injected directly into lesions to help reduce the size and pain of inflamed cysts and nodules. And we have our summary of drugs used for the treatment of acne, which we've went over, but we have warning labels here, so we'll go over some of them. Keep away from eyes and mouth, which makes sense. You don't want to get those creams or gels or ointments into your mouth. All of these should be applied externally. Benzoyl peroxide is considered a bleaching agent, so you should avoid contact with fabric and hair, which is a good one to let your patients know, but not counsel them on that. Do not use if pregnant. So the terazotin and the tretinoin may cause sensitivity to sunlight. So tretinoin and tretinoin plus clindamycin. So this is really important. I know that we've talked about this before, that if it causes sensitivity to light or sunlight, that means if you go outside in the sun or like go to the beach or something, you're going to be way more burned than you normally would be, especially when we talk about topical products, because you're applying them right to the skin. So it can reflect off the sun and burn you way quicker, faster, and harder. For the systemic medications, the doxycycline, monocycline, and tretinoin, all say avoid prolonged sunlight. Minocycline, you should avoid taking acids, iron, and dairy products. Isotretinoin says you should take with food. You should avoid pregnancy and doxycycline, minocycline, and isotretinoin, and avoid use of vitamin A as well in isotretinoin.